the respected principal George Verghese sir and the vice principals and all the faculty members for those nice words. And I don't deserve all of them, but then I express my sincere gratitude. It's a great opportunity for me to actually present it here. I've kept this presentation as simple as possible because I didn't want to confuse or make it too tedious. So experienced researchers may find it a bit boring, but then it can be interesting and useful for people who are going to do some research in the future. So these are the essential points for any research proposal. These are the essential subheadings. So we probably need a title of the research. We need to have an introduction, basically explaining why why are we doing this research. We need to define a very specific research problem. We need to have the hypothesis that we are testing using this research. We need to clearly define the research objectives, have a methodology in place. We also need a work plan. I'll go into detail about what all of this is. We need to have a work plan in place, how we are going to carry out this research practically on the ground. We have to have a research management plan, risk management plan, and how do we plan to publish or disseminate the results, and of course references and annexures. So the title of the research, that is one of the most contentious of all issues. How do you frame a good title? A good title, as we all know, should be short and concise. Some people write whole sentences as titles, which may last for 3 or 4 lines. But then I think the best way to go about framing a title is to keep it as short as possible. And but then it should be clear enough to convey the central objectives to a discerning reader. And this is the usual format. You can see PICOT or PICO or PECO written there. This PICOT statement is something which people follow for titles. So what is a PICOT statement? P is actually the population, I is the intervention, C is the control, O stands for the outcome, and T for the time or the timeline. So these are the essential things that any title should be having. So some studies may not really have a time bound or a timeline in place. It may not be time dependent. In that case, PICOT will turn into PICO. PICO. We don't need a time component in the title. It can even be PECO. Many of our studies are actually observational studies in which we look at exposure and outcomes. So in those cases, we probably look at it as PECO, where population, exposure, control, and outcome should be mentioned as a part of the title. So this is just for your practice and understanding probably. You can go back and look at one of your, probably imagine that you're planning out a study. I want to find out the prevalence and risk factors for periodontal disease. So how do you frame a title for this? I'm clear in my mind that I want to study the prevalence, like in a certain population, what proportion of that population has periodontal disease, and what are the predisposing factors for developing periodontal disease. These are the 2 things that I want to study. But then the thing is, when you want to frame a title, you want to mention what is the population that you're going to study. Population can be periodontal disease is common among high school students. So do you want to study the prevalence among high school students, or you want to study the prevalence among people coming to a dental care institution, or do you want to look at Kudumbashree workers with periodontal disease? So you have to be very clear about the population. In this case, can you try to identify the exposure and the outcome? If you carefully analyze the statement, these kind of prevalence studies don't really have an exposure. There is only an outcome that we are trying to measure here. So what I was trying to say is that not all not all titles will have all these PICO in them. Sometimes it may be just a PO, a population and outcome measured. So the title need not have all the components all the time. So in this case, the ideal a title may be a study to find out the prevalence and risk factors for periodontal disease among high school students in in a school in South Kerala or something like that. So the population and outcome has to be clearly mentioned here. But then if there is an intervention, it has to be mentioned there. If you're looking at a cohort study or if you're looking at a case control study, then the exposure and the outcome factors also need to be mentioned. Okay, coming on to introduction. A lot of people actually write introduction about, they confuse introduction with review of literature. But then actually, a review of an introduction actually means the basic justification for the study. It is a section which is meant to convince the reader regarding the relevance of the study. So it has to mention the magnitude, how much is the problem, and how severe is the problem. Why are you doing this particular study at this point of time? That is the whole idea of writing an introduction. This introduction should be clear enough for a person to actually get interested to read through the entire study. And most of the time, your study may be evaluated by a person who may not be familiar with your occupational background or your professional background also. So suddenly you're doing, imagine you're doing a study in periodontal disease, and the person evaluating that study may be a pathologist who may not really understand the clinical aspects of periodontal disease. So your study needs to have, need to have a robust introduction, adequate enough for a third person to understand, like a person who's not introduced into your topic to understand what is the proposal and why you're doing the study at this point of time. So the relevance in terms of the magnitude of the problem, the severity, and why are you doing this now, the time has to be mentioned very clearly as a part of introduction. And then comes the review of literature. So I told you that a lot of people can confuse introduction with review of literature. They do a short review search on PubMed and find out a few articles, and then they put it in the introduction, and the rest of it in review of literature. That is not the case. Literature review is a summary of similar research studies done elsewhere, and probably similar to the kind of research that you're doing. What is your background information on which you're basing your study? So you know hmm, what we are trying to do in these kind of areas is that we are trying to kind of make sure that some work, some thinking has already gone into the planning of the study, and at the same time we are conveying to the reader that I am capable enough of understanding what are the existing research in this particular area, and how do you expand on it. So that is the entire idea of having a review of literature. So introduction, you're basically, you're giving a short background, you're justifying why you're doing this study at this point of time. Review of literature is basically, you're trying to kind of explain to the reader about what has already been done, what are the kind of evidence which is available, and how are you going to expand on that available evidence, and what is your reasonable expertise, or the thought process which has gone into the planning of the study. So in IRB proposals, we give a significant importance to introduction review of literature to make sure that the researcher is well versed in that topic, and also they understand what are the existing research articles, or what has already been done in that particular domain. And the other side of it, why we insist on review of literature, is that uh, a lot of studies get done, but then they don't get published. The problem with uh, studies not getting published is, after the study is done, many people actually lose interest in that, especially if the results are negative. Many people actually lose interest in that. They don't get it published, and especially in the case of postgraduate students. So if the review of literature is done, the introduction is done, almost one third of the paper is already done. So that is the reason why we insist on having a review of literature. So it'll be very easy to actually go about writing a paper or making a paper from this, from the study results. So why are we doing the study? Except for PG students, most of us are doing the study for publications. If your study is not getting published because of uh, you know uh, some kind of lethargy from our side, then that is the criminal waste of resources. It can be time, money, or any other resource. So that is why we are insisting on having an proper introduction and a proper review of literature for IRB proposals. Many a time it is not done because people don't see an advantage in doing this before starting the study. Anyway, the argument is that anyway we are doing it during the study or when we are doing the paper. And introduction and review of literature are expected as paragraphs and not as bullet points. A lot of people come to us with, one, this study says so, two, this study says so, three, this study and this study contradicts these results. That is not what is expected. It should be a seamlessly blended two sections. So in the introduction, you basically justify why you're doing the study and stated the magnitude and everything. And in review of literature, we are stating the background research and what has already been done. So it should be seamlessly blended, and at the same time, it should be easy to read as a paragraph. So you cannot submit a review of literature or an introduction as bullet points. That is not a format which is followed anywhere in the world. Then comes to the research hypothesis. So in a research hypothesis, what we are trying to do is that we are defining a predictor relationship between one or more independent variables and one dependent variable. So that is what we are trying to do in any research hypothesis. How is the independent variable related to the dependent variable? The independent variable can be one or more, and how is it actually related to the dependent? I'll come to an example. So these are actually meant to be informed statements, not haphazard guesses. Like so, anybody can guess about anything. A homeopath can actually say that whatever they are giving, this arsenicum album actually works for preventing COVID-19. That doesn't become a research hypothesis, essentially because that is a haphazard guess, because they don't know. There is no background data available. There's no animal studies done. They have no evidence available to make that particular guess. So but then our research hypothesis should be different. It should be made. It should be actually made on a certain degree of background research, and probably what we just mentioned. It should be based on. We should be relatively clear about what has already been done, and we should have a reasonable confidence about what we are doing. So just to illustrate the null hypothesis, alternate hypothesis thing, we always, especially the statisticians, they insist on having a null hypothesis and an alternate hypothesis. So the null hypothesis, as it's mentioned in the slide, assumes that there is no relationship between two variables and that the controlling variable has no effect on the other. Like the dependent variable is not controlled by the independent variable. That is what the null hypothesis say. And in a study, we are essentially trying to disprove the null hypothesis. So in the first picture, you can see the cats show no preference for food based on the shape. But then when the actual idea that we are trying to research is, does cats show some preference for food based on the shape? The second one, the study is actually trying to prove whether plant growth is affected by light color, but the null hypothesis is just the opposite. So we actually try. I mean, we always wondered, why do you want to have a null hypothesis and alternate hypothesis? So the essential idea in this is it is actually easier to disprove things than prove it. For example, it is much easier to disprove theory of evolution than prove it. It's very difficult to prove it. So those kind of things, any kind of theory, existence of God, or whether Big Bang is actually a fact or it's a figment of imagination. All of these are actually, most of the theories are easier to disprove than prove it. Proving it takes a lot of effort. So that is why we are actually doing it on the other way around. And we all wonder about what a p-value is. Essentially, a p-value is is nothing but the probability of null hypothesis being correct. So if we always say p-value of less than 0.05 is statistically significant. So what does it mean? It just means that the chance of a null hypothesis being correct is less than 0.05, as in there is less than 5%. If you convert that p-value just a proportion into a percentage, it just means that the probability or the chance of that null hypothesis being correct is less than 5%. So we can actually reject the null hypothesis and accept the alternate hypothesis. So that is what the null hypothesis and alternate hypothesis is all about. It's easier to disprove things, and p-value is all about the null hypothesis being correct. If it's less than 0.5, that is, if the chance of a null hypothesis being correct is less than 5%, we can conclude, it is more or less reasonable to conclude that the null hypothesis is wrong. And in that case, we can easily accept the alternate hypothesis. So that is essentially null and alternate hypothesis. So how do you frame a null hypothesis and alternate hypothesis for this particular question? I want to find out whether remdesivir is effective for COVID-19. So, conventionally, when we do statistical tests, we are trying to prove or disprove null hypothesis. But then when in a research proposal, you should be writing at least the alternate hypothesis. What are you trying to find out? In this, what are we trying to find out? We are trying to find out whether remdesivir is an effective treatment for COVID-19. But then does it qualify as a hypothesis? That is my question. No, it doesn't. We have to be much more specific if we want to kind of make this particular question into a hypothesis. So in this, it is not clear about what kind of COVID patients. Is it any COVID patient, or is it hospitalized COVID patients? It is not clear whether the COVID patients that we are referring to are suffering from any respiratory morbidity, or are they breathing in free air? Or do they need the respiratory support, or probably they are able to maintain their saturation otherwise? And what are the outcomes we are trying to measure here? Are we trying to measure mortality, or are we trying to measure hospital stay? So all these factors have to come into research hypothesis. So if I want to make it better, I probably will say the research hypothesis is that remdesivir is effective in reducing hospital stay for patients admitted with COVID-19 into a healthcare facility and who does not require ventilatory support. So that is my research hypothesis. So I hope you understand how to frame a research hypothesis and what is the difference between null and alternate hypothesis. So if I want to frame a null hypothesis in this, I will say remdesivir is not effective in reducing hospital stay for patients admitted with COVID-19 to a healthcare facility and not receiving respiratory support. But then that is the entire, it makes it very, very specific, and your whole study is actually trying to prove or disprove the null hypothesis rather than disprove the null hypothesis. So you have to be specific enough. These kind of vague statements like remdesivir is effective for COVID-19 does not mean anything. Coming on to research objectives. Research objectives are the basically they are the goals which we are trying to achieve from the particular research. So it has to focus on the study, and it has to be narrowed down to the bare essentials. It has to make sure that we don't collect data which are not strictly necessary for understanding and solving the problem that we have identified. And lastly, framing hypothesis, or rather framing objectives will help us to organize the study clearly in defined parts. Okay, so it is for our own sake that we are writing research hypothesis. It gives us a lot of clarity. It gives enough provision to avoid redundancy, and it helps us to organize things in such a fashion that we are able to undertake the research with minimum resources as possible. So how do you frame objectives? We have all heard about SMART objectives. SMART stands for specific, measurable, attainable, reliable, and time bound. There are a few confusions regarding what SMART stands for. There are slight variations in how people interpret it, but generally people interpret it as specific, when you frame an objective, it has to be specific enough. I gave the example previously about remdesivir and COVID-19. Just mentioning that remdesivir is effective for COVID-19 does not mean anything. So you have to be more specific. It has to be measurable. Certain things like relief of symptoms and all does not mean anything. It has to be either a scoring system, or it has to be probably, if you're measuring pain, it has to be on a visual analog scale, or whatever you do, make it measurable, than vague statements. In this case, remdesivir is effective for COVID-19 can actually mean a lot of things. Effective in reducing the severity of illness, effective in reducing my breathing difficulty, probably effective in reducing the amount of cough. So it is not, many of these things are not measurable. But then if you make it more measurable, to make it more measurable, you can specifically mention it will reduce the duration of hospital stay as measured in days. Okay, so that makes it much more measurable. Whether it's attainable and reliable is a question that the specialist needs to ask. The person planning the study needs to ask himself or herself. Whether the objective, what we are trying to measure, is it reliable enough? If you're trying to find out patients suffering from COVID-19 using an antibody test, which is notorious for poor sensitivity and specificity and all, especially sensitivity, then that is not reliable enough. So whether your measurement tool is reliable enough, whether what the objective you're trying to measure is it reliable enough, that is what you need to ask yourself. And if there is a time component attached to it. So all the objectives has to be smart. So I'll give you another example. I want to find out the effect of using dental laser and flap surgery for chronic periodontitis. Okay, so the question that I need to answer is it how do you frame objectives out of it? So you need to have specific, measurable, attainable, reliable, and time-bound objectives. How do you make objectives? You can go back and try it at your home. It has to mention what is the effect you're trying to measure. Is the effect on wound healing? Is the effect on ease of doing surgery, or the effect on the number of hospital visits which are needed? So the effect can mean a lot of things. So you have to be very specific about what you mean, and and the effect that you're trying to measure has to be reliable also, and also it has to be measurable. So just saying that one is effective over the another does not mean anything. You have to be as specific as possible, and even there can be significant differences when different institutions are involved. The kind of patients coming to Pushpagiri may be different from Kottayam Dental College. So you have to probably mention which is the place that you are doing the study. And even chronic periodontitis does not mean anything really. It can be as simple as a gingivitis, or it can be as serious as an advanced periodontitis. So you have to kind of narrow it down and say which kind of patients you are including. So you can one of the objectives of the study would be to find out the effectiveness, or rather the effect of using dental laser and flap surgery for advanced chronic periodontitis in reducing the number of hospital visits after the surgery among patients undergoing the procedure in a tertiary care hospital in Central Travancore. So that can be an objective. Objective can be long, but then you have to be specific. It has to be measurable. It has to be reliable. So these are the things that you have to keep in mind by framing objectives. Just mentioning that to find out effect of dental laser and flap surgery for chronic periodontitis does not mean anything, and that does not qualify as objectives. So I hope I'm clear in this. And you can have multiple objectives. So one can be the effectiveness in terms of the number of hospital visits. The next objective can be about the pain score probably, or the kind of healing which happens. Or the third objective can be about the adverse effects, measurement of adverse effects of using a dental laser and flap surgery only. So that kind of, like, those kind of things all needs to be a part of the objectives, and we can have multiple objectives also. But the research hypothesis for the study will be only one, and your entire study will be actually uh, you know um, trying to disprove the null hypothesis or prove the alternate hypothesis. I hope I'm clear till now. Coming on to the most important part, that is the methodology. What is methodology? This is basically the summary of the most important points in the methodology section of the study design. Before actually going about methodology, we need to be very clear about what are the variables you're going to measure. What are you going to measure? What are the different things that you're going to measure in your study? So there are four important type of variables. I was mentioning about independent variables, which are mostly predisposing factors. If you take the example of again, periodontitis, my frequent interaction with Dr. Nebu has made me an expert in periodontitis, probably. So I'm just kidding. So what are the risk factors for periodontitis, or what are the predisposing factors you're going to measure? One can be even age. Age can be a risk factor. Gender can be a risk factor. Socioeconomic status can be a risk factor. Place of residence can be a risk factor. Access to dental care services can be a risk factor. So you make a list of variables, or rather predisposing factors or risk factors, which are classified as independent variables before you actually start the study. The second one is the dependent, the outcome variables, which you're going to measure. One can be, in the case of flap surgery without laser, flap surgery with laser, you can think about various different outcomes that you want to measure. The primary outcome can be the number of hospital visits. The secondary outcome can be the pain scoring. The tertiary outcome can be the extent of teeth restoration. There can be multiple outcomes that you want to measure. Adverse effects can be one other outcome. So you try to enumerate what are the dependent variables you will measure. And of course, what are the confounding variables? Like the most important example of confounding in any research is typically said as the relationship between high altitude and thyroid hypothyroidism. So people thought that high altitude is a risk factor for hypothyroidism, but then suddenly people found that it is not high altitude which causes hypothyroidism. It is actually the iodine deficiency, and high altitude areas tend to have deficiency of iodine in natural sources like water or soil. So it is actually the iodine deficiency which causes the impact, or the dependent variable to change, but then we confound it with something else. So that can happen in every research. So you actually watch out for confounding factors which can actually affect your research, which can include the baseline level of the periodontal disease. So if you're doing any kind of procedure in a patient with a worsened disease condition, your outcome variables will be affected. So that is not really dependent on the type of procedure which is being done, which is the laser or the flap. It is basically dependent on some confounding factor, which in this case is the severity of infection or severity of disease, which can affect the outcome. So you need to have a list of confounding variables, and in any research you need to adjust for these confounding variables using any regression model. There are various different methods for adjusting for these confounding variables that may not be needed for a postgraduate thesis, but then at least a faculty level project we need to adjust for confounding variables. And of course the background variables that you're trying to measure, which may be important in an epidemiological study, not too much in a clinical study. So if you're going to find out about the prevalence of chronic gingivitis in high school children, you probably need access to background variables like the type of schools which are there, the number of students there, the number of dentists per thousand population in this particular district, the socioeconomic status of the general human development index of the district, and things like that. So a lot of background variables are needed. So all these has to be very clear before you actually start out a study. Coming on to the methodology subheadings, these are most important things which a lot of people forget to add. Nowadays, I think Dr. Nebu is saying that a lot of people are deleting stuff also from the IRB form. So, please don't do that. These are the essential things that we need in any IRB form. This is, if you're clear about all this, your materials and methods section for the paper is also done. So if you're writing the introduction and the review of literature part of your IRB form properly, then your basic background is done. One third of your paper is done. Then if you're actually following the methodology section properly, if you're trying to answer all these questions properly and include something about each of this, then essentially your methodology section is also done. So more than 50% of your paper will be already done before even you start doing the study. That is the whole idea of having a proper IRB form and following that proper IRB form. So this is I mean, like, more than postgraduate, it's very important for the faculty to be following this. So these are the essential subheadings that we need in any section on methodology. So our IRB form may slightly vary depending on the institution where you are in, but then essentially these are similar in terms of the kind of subheading. So first is the study type. Whether you have to mention whether your study is an observational study or an experimental study. Observational studies can be case series, which you are reporting from a clinic, or it can be a cross-sectional study trying to find out some proportion or a prevalence. Prevalence essentially what we do as a cross-sectional study. We may want to find out risk factors for certain disease, which can be found out through a case control or cohort study. We may be trying out trying to find out the effectiveness of certain things, like a new treatment methodology or a new approach or something like that, that can be done through a randomized controlled trial. Trials are discouraged, at least at the level of postgraduates. It can even be a qualitative study. What we mentioned till now is all quantitative studies where we look at numbers and percentages and all that. But then qualitative study is also coming up in a big way. It used to be very big in social sciences, but then now medicine is also using it, especially things like access to healthcare or the quality of healthcare services. We cannot always define it in terms of numbers and percentages. So qualitative study is also possible in any kind of research. It can be retrospective or prospective, depending on the kind of data you're working with. So mention about all this in your study type. So you mentioned, in a normal prevalence-based study, it will be an observational study using cross-sectional methodology, and that's it. So in a cohort study, to find out certain risk factors for a disease, you mention it as an observational study using a cohort methodology. It will be a prospective study. So you mention all that in study type. Next, it's about study population. Clearly define the participants for the study in terms of disease condition, age groups, and other characteristics. Like I mentioned about the study to find out the prevalence of chronic periodontal disease. You have to mention what is the study population, the age groups that you're going to study, and from where the study population, from where the study participants will actually come in. The study setting has to be mentioned clearly, because the profile, even if you're doing a healthcare center-based study or a hospital-based study, the kind of patients that you're getting may be entirely different. Like, the central Travancore region in Kerala is known for a very high human development index. So even if you say Kerala, the state of Kerala, the HDI or the access to healthcare or the financial capabilities may be vastly different from for example, a district like Kasargod and a district like Pathanamthitta. So you have to specifically mention the study setting. So study setting can be the center where you're recruiting patients, or in the case of epidemiological studies based out of the community, it can be about the community that you're accessing for the study. We have to mention about the study period also. When is the data, when will the data be collected, when will it be analyzed, and when will the write-up be done, especially like studies involving infectious conditions are very sensitive to time. Most of the infections be it upper respiratory infections or diarrheal illnesses in our case, happens during the rainy season, probably from June to September or October. So it is very time dependent. So suddenly, if you say that the incidence of certain upper respiratory infections is very low in Pathanamthitta district, and suddenly you see that the study was done in Jan, February, and March, that doesn't mean anything. So that is what that is why the study period is very, very important, especially in terms of infections. And in other cases also, certain chronic conditions also tend to flare up in certain time. Inflammatory conditions flare up during winters. So a lot of studies are actually time dependent, and you have to clearly mention when did you do the data collection, and when are you planning the analysis and the write-up and all that. Coming on to the sample size, ideally consult a statistician for this, but then there's actually no need to go to anybody for calculating sample size. There are so many online calculators, free online calculators, just that you have to understand these two broad principles. One is, when you're trying to find the prevalence is basically the proportion of people with a certain disease condition. Okay, so when you're trying to find out a prevalence of a relatively rare condition, the sample size will be very high. So if you're trying to study the prevalence of blood cancers, occult blood malignancies among school children, the problem is you may have to study at least 1 lakh children to get something reasonable. Okay, but then if you're studying something very common, study the prevalence of and I can't imagine the prevalence of anemia. Anemia is supposed to be quite high in these parts of the country, even though our nutritional status tends to be very good. So if you want to study the prevalence of anemia, then the sample size will actually be low, because the proportion of people suffering from anemia is expected to be very high. So rare conditions, if you're doing a prevalence study, the sample size will be very, very high. If you're studying a relatively common condition and you want to find out the prevalence, the sample size will be low. So just imagine that, just remember that. The second one is when you're studying the difference between two or more groups, like in the example which I gave, you were trying to study the effectiveness of using a dental laser with flap surgery versus use of flap surgery alone. Okay, so and the outcome you were trying to study was the number of hospital visits. So if you imagine that the dental laser was going to reduce the number of hospital visits from 5 to 1, uh, then that actually that difference is quite high. When the difference is quite high, actually the sample size will be very, very low. Okay, so when the difference is very, very small, the sample size required to distinguish that difference is very high. So I hope you understand what I'm trying to say. If you're expected, if the outcome is very different between the two groups that you're studying, okay, then the sample size will be very, very low. But if you're expecting only a very small difference between the two groups, then your sample size would be very, very high. So if you remember these two broad principles, you can actually do your own sample size calculation. It's quite straightforward. The sampling methodology is basically most relevant for epidemiological studies. Does your study have any specific sampling methodology? It can be some random sampling methodology, like simple random sampling, stratified random, systematic random sampling, and cluster random sampling. I don't want to go into the details of it. But then these are essentially some kind of randomness in selecting patients. Okay, patients rather the participants are not selected. You know, you cannot predict the participant selection process. There is some randomness involved in that. So whether your study is following any specific random sampling methodology, or in most of our cases in hospitals, it's like consecutive sampling. We if it's a relatively rarer condition, we just take whoever comes to us. Or some of the studies even follow convenience sampling. It's a relatively common condition, and you want to find out certain specific things in that relatively common condition. We just do a convenience sampling, conveniently select whoever comes to us. So these are the various sampling methods. We have to mention about inclusion and exclusion criteria. It has to be as specific as possible, because it should not leave any space for any confusion. So So I was mentioning about the importance of the study to find out whether remdesivir is effective for COVID-19 patients. So you have to be very specific, whether it's any COVID patient, even the COVID diagnostic criteria, you have to be specific. Like, is it COVID diagnosed through RT-PCR test, or COVID diagnosed through RT-PCR and TrueNat/CBNat test, or COVID-19 diagnosed through any test, which can even be antibody-based test. So you have to be very specific. Like, is it effective in pediatric age group? It may not be effective in very old adults also. So very specifically, you mentioned those diagnosed as COVID-19 using RT-PCR test, age between 18 and 65, or age between 18 and 80. Mention it, make it as specific as possible so that there is no room for confusion. And exclusion criteria, usually a lot of people say exclusion criteria is the opposite of inclusion criteria, which is not true. Some of the clinical trials may mention that for clarity's sake, but then normally that is not true. uh, in the people who satisfy inclusion criteria, do you want to exclude somebody? So that is the whole idea of exclusion criteria. So a person with immunocompromised condition may have a different disease course or COVID-19 disease course as compared to a immunocompetent adult. So you may probably need to, even though the person who is immunocompromised will satisfies the inclusion criteria of being COVID-19, age between 18 and 65, and admitted without any respiratory support. But then they have an underlying immunocompromised state. So the disease course may be actually different. So you want to exclude that patient. So I'm just trying to give an example. So in patients or in participants who satisfy inclusion criteria, do you want to exclude somebody? That is the whole idea. And coming on to study tools, basically whatever we use for our data collection can be a tool. It can be a questionnaire, it can be analytical techniques for samples, like which machine you're using, which kind of analytical method you're using. It can be some scoring system, like acute appendicitis or acute pancreatitis. There is a Ranson's criteria, an Alvarado score for acute appendicitis. There can be liver disease can have different scoring system. Rheumatic heart disease can have scoring systems. So I'm sure that in every field of medical science, there will be a kind of a scoring system. Even animal models can be your study tool. Cell lines can be your study tool. Radiological tests for gathering data can be your study tool. And you have to you shouldn't just mention it. You should be describing them in detail. Especially your data collection tool, whether you prepared it or is it a standardized one. If it's not a standardized one, how did you validate that? What are the analytical technique you're using for processing of samples? How was it collected? How was it transported? Who did the analysis? What is the technique which was used? Which was the machine which was used? Even in scoring system, give a proper referencing of the scoring system. Was there any study validating those scoring system that you're using? So mention about all this for clarity's sake, and for the reviewer to understand that you've thought through each of this. And this can be very important while you're writing your paper also. It can make the process very, very easy. Okay, so if you can read through this particular cartoon, okay, it mentions that never stop buying. One person with a lot of money is sitting and saying that never stop buying lottery tickets, no matter what anyone tells you. I failed again and again, but I never gave up. I took those extra jobs and poured the money into tickets, and here I am, proof that if you put in time, it actually pays off. Is there any truth in this? I'm working hard, and I've just won a lottery. Okay, so I won the jackpot, and it is my hard work which actually made sure that I won the jackpot. And I am an example for you, so you please follow it. So this is a typical example of something called survivorship bias. um, every inspirational speech by given should ideally start with disclaimer about survivorship bias. Say 10 people following the same path, that does not essentially mean that all the 10 will have a same result. Okay, that is all about survivorship. It actually depends on the kind of conditions, and it depends on the kind of probably, I mean, it depends on your luck and a lot of other factors also. So any method, any study will have a lot of bias. Okay, and that is inevitable. It has to happen in every studies. Even though there are different classifications of bias like Bergsonian bias and survivorship bias and this and that and all that, but then essentially there are only two different kinds of biases. One is a selection bias, and the second one is something called an information bias. So what is a selection bias? A selection bias is something, is a bias which happens during the selection of patients. Okay, so I'll give you an example. If there is a systematic bias in selecting patients, like you remember about the study in which you were trying to find out the difference between hospital revisits after two procedures, one with dental laser and flap, and other one is flap alone. But then imagine subconsciously or consciously, the recruiting doctor thought that dental laser is slightly more expensive, so we will actually reserve that for more sicker patients, people who have a more advanced disease. So if there is a bias like that, what essentially is happening, you are actually doing the dental laser with flap on more people with more severe disease, and the outcome is going to be flawed. Your entire study is going to be flawed. You will probably find out a result that dental laser has absolutely no impact on disease outcomes, but then the problem is there was an impact. There was a systematic problem in selection of patients. More sicker patients or more severe patients actually got selected into the laser arm. So that is actually a selection bias. Information bias is some kind of a deficiency in gathering the information, which can happen. I'll give you an example of something called a recall bias. So if you interview one mother with a typical example is interview one mother with a baby with congenital anomaly, and a mother with a absolutely healthy baby. If you ask them about their antenatal period, the mother with a slightly deformed baby will actually give a lot of examples about possible exposures. I remember having an X-ray at, I stood next to the X-ray room in the hospital. I had taken a couple of paracetamol tablets when I was 17 weeks. I had actually gone out and did this, did that, and all that. They will remember everything, but then the mother with the healthy baby may not remember anything. So that is a typical example of an information bias. In that case, it is called recall bias. So there is a systematic problem in gathering the information. So that is what essentially happens in an information bias. Typically, if you're doing an interventional study, I think somebody's cursor is creating a lot of problems. Okay, so never mind. So if you're doing a kind of an interventional study, something the kind of follow-up which is happening, if there is a selective loss to follow-up in one part of the study or one arm of the study, like if the patients who are undergoing laser and flap surgery, they are actually having more problems, associated with burns or laser injuries or something like that. I'm just assuming. I haven't even seen a dental laser in my life, but then I'm just assuming that if they have a more problem, a worse disease profile after the intervention, they are probably more likely to go to a different dentist and get it done. They can easily go to a different center and consult a different periodontist. So we won't get the result from them, and essentially we will end up with a lot of results from the people who only had the flap surgery. But then the other side of it is a lot of loss to follow up happening. So what essentially we are gathering is that uh, uh, we'll get a very flawed sample, or we'll get very flawed information from the people who had flap and laser. So that is the whole idea of information bias. So you actually assess, you go through your study, try to assess whether there are possibilities of bias. Every study will have possibility of bias. So you mention them, you identify them, you mention them, and you state about the plans about how to minimize it. You cannot really say that my study does not have any kind of bias. You have to say that these are the possibilities for bias in my study, and these are the things that I'm going to do to reduce the bias in my study. That this is the only thing which is possible, and that is expected from any reasonable researcher. We also need an analysis plan. We can consult a statistician or epidemiologist for this. We probably, I think the IRB form, we are looking for how the data entry will be done. A lot of people use Microsoft Excel for data entry. Microsoft Excel is not a data entry tool. We have several other data entry tools. Excel is a spreadsheet. There's a difference between that. So how the data entry is done? If there are several advantages of using data entry tools for data entry instead of an Excel spreadsheet. We can probably take a different session on that. So how the data entry will be done, which software will be used for data analysis, basics about what are the kind of statistical tests that you're going to use and all that. So that has to be included as a part of the analysis plan. Again, I initially told you, before you start the study, you have to be very clear about the kind of variables you are dealing with. What are the independent variables, or rather, the predisposing factors? What are the dependent variables, which are the outcomes that you're trying to measure? What are the confounding variables which are possible, and what are the background variables? Be very clear about what you want from the study, which all variables you want to measure from the study. And in the methodology, specifically mention that about the independent and dependent variables, and how do you handle them? That is a question a lot of people have a problem with. This is especially important for qualitative variables. For example, you mentioned that BMI. I'm going to calculate BMI. I'm going to take height and weight and calculate BMI. But the problem lies, how are you going to classify it? There are different classification systems for BMI. Depending on the Indian classification, apparently says that anything about 23 kilogram per meter square is calculated as is classified as overweight. But then Western classification system says more than 25 is overweight. Similarly, for American Heart Association says any cholesterol levels, about total cholesterol levels above 160 will be considered as dyslipidemia. But in the Indian Council of Medical Research says about 200 is fine. I mean, up to 200 is fine. So how do you classify or handle the quantitative variables? You have to measure very, very clearly. Again, you may be taking the details about income of the patient. How are you going to categorize it and use it for your analysis? So mention about the variables that you're going to collect and how specifically you're going to handle them for your analysis. That is very, very important, especially for faculty studies. And I hope you understood what I'm trying to say here. You also need to have a work plan in place. A work plan has to be, quite clear about what are the tasks to be performed, when will the task be performed, and who will actually perform the task. Okay, so this can actually help us to organize our research better. So especially if you're having a dissertation, there may be some small faculty projects which may run for a couple of months. May not need a work plan. But then if you're thinking of a multi-year project, a 2-year data collection process, then you probably need a work plan just to make sure that you are in schedule, you are following the schedule, and you probably can kind of get the research to a reasonable conclusion. A very easy way to actually do this work plan is to have a Gantt chart in place. I think most of you are familiar with the Gantt chart. So you can mention the time on top, the actual activities on the left side, and you can actually color code it. The color coding can be done based on who will do the kind of research. This is a very simple Gantt chart. So each square can be of a different color, and each color can mean a different investigator. So a part of the study may be done. I know for sure that the research center people like Dr. Prashant. Prashant is doing a couple of studies, which are a part of it is done in VIT. Part of it may be done in Cochin University. A part may be done by Prashant. it can actually mean different columns can be color coded depending on the kind of people who are doing the study. So by looking at the Gantt chart, it is quite easy for people to discern who is going to do what and what is going to happen at which point precisely, and whether we are following the schedule. A lot of these Gantt chart templates are available online. A very significant thing that we miss all the time is a risk management plan. A risk can be very diverse. There can be risks in recruitment of the study, recruitment process of the study, conduct of the study, health of the participants, especially if there's a interventional study. There can be protocol violations. There can be funding issues, publication problems, etc. I'll give you an example. So certain studies, you may not get enough participants to recruit, especially if you're looking at some specific intervention in a rare disease condition. You may not have participant. You have proposed a single center study. You may not get enough participants to include in the study. Then what are you going to do? So if you have thought about that initially, that there can be a problem in the recruitment, we possibly may not get enough samples from this particular institution, like from Pushpagiri. What are you going to do? Which are the other institutions you're going to approach? And do you have any reasonable contacts in those institutions? So that can be a risk assessment. Okay. So there can be funding issues. At the end of a lot of these government funding agencies are notorious for stopping funding after a certain period of time. This may be a 5-year study. After 2 years, they may say, okay, we are going to stop the study. We don't see too much of a value coming out of it. The government of India and even the government of Kerala is notorious for doing that. So those kind of things are also a risk. Actually, we probably need to account for that. So we probably need to have a plan for everything. So a risk assessment, a risk control plan, a risk communication plan, and a risk review plan is needed for every large study. So if you're not doing a very large study, if you're not doing a multi-institutional large study, then at least do mention about the possible risk in the study and how are you going to mitigate it. At least identify the risk and at least have a mitigation plan for each risk. But then if you're a large study, you have to have a proper risk assessment done. You have to have a strategy for risk control. You have to communicate how do you communicate the risk to all the stakeholders concerned, right from the patients to the funding agency, and how do you periodically review the risk. So this is for the large projects, and the smaller projects, at least mention about the risk and how do you mitigate it. Coming on to the last parts, the ethics that you're going to follow, the ethical aspects of your research has to be mentioned clearly. Your study needs to have an ethics committee clearance. It can be the IRB or it can be the Animal Ethics Committee, wherever. We mentioned that you are going to submit it for IRB or whatever clearance. So mention about having an information sheet. If there are human participants, you will need an information sheet in English and in local language. You'd also need an informed consent. So information sheet is basically you're conveying to the participant, the potential participant, about what is the study about, what are the possible risks and benefits, what are the contact details. If you have any problem, who can you contact? If you see any protocol violation, whom do you complain? To whom do you complain? So all those things would be part of information sheet. Informed consent is basically about the patient giving an consent to participate in the study, truly understanding what it involves. So information sheet and informed consent has to be in English and in local languages. There has to be a mention about what are the processes that you're going to follow for data safety. Data safety is not a very, and even confidentiality is not a very, very big issue in developing countries. We are not so sensitized about data safety. I think right now, with all Facebook and social media coming in, we are a bit more aware about data safety. That is why people have started locking their Facebook profiles and all that. But then in many other countries, a breach of data safety and confidentiality is considered as a criminal offense. You can get prosecuted for that if your personal data is shared with somebody else, or the research data is shared with somebody else. So mention about how are you going to password protect your file? Are you going to keep your forms under lock and key? Are you going to allow very limited access to the other people involved in your study, or things like that? So mention about that. Also mention about the publication ethics. Mention very clearly that you're not going to send your publications to a predatory journal. You're going to have certain standards in selecting journals for your publication. So mention that very, very clearly. The problem with, I think all of us are very familiar with the problems associated with predatory journals. You give 3,000 rupees and they will publish anything under the sun. And there is no standard, there's no review process. So ideally you have to kind of stop that. Without knowing it, a lot of people have published in the past, but then now in the last 3-4 years, the awareness about predatory journals are very high. No researcher can say that I didn't know that it was predatory, because a lot of Western evaluators consider that as an immediate red sign that this particular researcher is not dependable. And then, of course, before you do the study, at least read the Declaration of Helsinki, the World Medical Association's Declaration of Helsinki, which came out initially in 1963, at least once. It's just a 4-page document. It'll probably make you understand research ethics a bit more. And with all this, what are your plans to prevent violation of ethical principles? Because you may not be the person who may be recruiting the patients, especially in faculty studies. The recruitment may be done by house surgeons or PGs, or even nurses. So in those cases, there can be probably violation of ethical principles regarding the information sheet may not be provided, the informed consent may not be taken properly, the data safety, it'll collect all the details in a questionnaire and keep it there in the nursing station. Those kind of things can happen all the time. So what are the plans in place to prevent all this? You have to probably mention it very, very clearly. And how do you plan to utilize and disseminate the research? So every research, mostly, if it's funded by national or international donors, they all look for you have done a wonderful research, you have published it. But then along with that, how do you disseminate the results among your peer group, or even among the target population that you're dealing with, if it's a public health based research? So that is also very important. So how do you plan to intimate the ethics committee or the research board or the funding agency about the research? It can be progress reports, it can be final reports. You will be making multiple publications. One study may result in 7 or 10 or even 20 publications. Large studies may have multiple publications coming out of it. So what are you going to publish? You have to be very, very clear regarding that. And are you planning to organize any seminar or workshop or conferences associated with this particular research project? So all of that has to be clearly mentioned. Okay, so sorry. And lastly, your references. So references has to be numbered. A lot of people limit their references to the introduction and the background. That is not true. You have to have references even for your sample size calculation. So if you're doing a study to find out the prevalence of gingivitis in high school students, you cannot just say that, I think that the prevalence is going to be 40% and I'll calculate my sample size. No, you probably needs to look around and see, okay, there is one study which shows that in Trivandrum, among children, the prevalence was 40%. So I don't expect a big difference from that in this population which I'm going to study. So probably I'll start calculating with the 30% prevalence, expected prevalence. So you cannot have haphazard guesses for your sample size. Also, you mentioned the reference for that. So, and also for the study tools, should have references, ideally should have references. So all that references has to be sequentially numbered, and it has to be listed in the towards the end of your proposal, ideally in Vancouver style. I'm not going to the details of how do you make references in Vancouver style, because that is an entirely different session. And use reference manager softwares if possible. There are several reference manager softwares like Zotero and Mendeley and all that, EndNote and all that. For most of these things, there are enough and more tutorials available online. Now it's all Coursera and several other online learning platforms will have tutorials for these reference manager software. It's quite easy. When you get time, when you go for a walk, just listen to it, and then you should be able to use it. If you have any problems, you can always come to us also. So And finally, you need to have annexures. Annexures will include the interview schedules, all the questionnaires, the informed consent form, the I mentioned about the information sheet, the ethical institutional approval for the study, if it is a multi-centric study which was approved previously by any other institution. So all that has to be a part of annexures. Thank you so much for your patient listening. It was a pleasure and privilege to be presenting in this in front of this august audience. If you have any questions, you can either unmute yourself and ask, or you can type it in your chat box. I'll be happy to answer that. Thank you.